there is a great deal of evidence out there that direct-to-consumer advertising stimulates prescriptions to be written for expensive medications, in many cases where those medications are not clinically indicated. And the reason is because there may be lower cost options, generic drugs, non-pharmacologic therapies, for conditions that aren't being advertised. But what we see is that when patients do bring these specific advertising-directed requests into physicians, that physicians in many cases will write the prescription for the products. And that's, again, there's surveys and plenty of other data supporting what Senator Durbin has to say.
John Kamp, what are your thoughts? Ban it or let people make up their own mind? It's just like anything else. This is the kind of bread I want. This is the kind of booze I want. These are the kind of pills I want.
Well, those who want a ban for direct-to-consumer advertising of drugs essentially are voting for ignorance among the American people. We believe that the best decisions are made when doctors and patients have good conversations that are based on facts. I disagree with Dr. Kesselheim on the idea that docs were automatically going to prescribe a drug that is asked for. In fact, there's really very good research. Dr. Richard Kravitz out of California has done some very good research and found that when patients ask for a specific drug, they don't necessarily get it, but they do get the standard of care in their area. So I think that we need to be very careful about what we ban in America.
So Dr. Kesselheim, respond to what John Kamp just said, but I'm curious, I mean, is the problem that you pinpoint in your earlier answer, does it really have to do with the advertising, or is the more central problem the relationship between the doctor and patient, that the doctor doesn't step up and say, okay, you bring me this advertisement for an $86,000 a year Hep C medication, and there's one that is going to work fine for you at $9,000 a year. Isn't that really what we ought to be focusing on here?
Well, I do think you have to focus on the advertisement itself, because in many cases the advertisements don't present a fully accurate picture of the product. They may.
So why don't you? Are doctors wimps? I mean, it's the doctor's job to say, actually, that doesn't apply to your case. I mean, why can't they do that? You telling me that as an industry you can't?
No, I think that doctors can do that, but I think that it is all, there is a limited amount of time. There are a lot of things usually to go over, and in many cases, again, I'm not saying that this is right or wrong. I'm just saying what the data show is that in many cases doctors will accede to the requests that patients make, and if those requests are driven by. How do you
handle it when someone comes to you, and how do you handle it?
Sure, I try to sit down and have a full conversation with them and explain what the benefits and the risks of the medication that they saw on television. If there are other medications that might be better or more appropriate for them. And again, it takes time, and in many cases, again, I'm not trying to blame physicians, because physicians have a lot to take care of in a relatively limited period of time, and these kinds of requests that are driven by advertising, patients can get the wrong impression about the product because the advertisement doesn't fully describe the risks, or may kind of misrepresent the benefits.
Doctor, I'm sorry to jump in. Just time is tight. John, you talked about ignorance, but I mean, shouldn't we be a little ignorant about this? I mean, this is specialized stuff. That's why folks like Dr. Kesselheim go to school for about 8 years after college, including their residency. I mean, do Americans need to understand all that stuff? Complicated medical stuff?
No, they don't need to understand all the complicated medical stuff. What they need to know is that there's an option available to them, that they can have a reasonable discussion with their doctors about those options. Doctors aren't stupid. They are incredibly intelligent people. My doctors like the conversations that I have with them about the options that are available to me, because it means that I am clearly invested in my medicines and the treatments that they're available to them. I think we need to have those conversations with doctors and patients so that doctors can make the decisions that are appropriate.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.